Doctor, thank you very much for joining us on Health Connection. Our topic is surgery for breast cancer, and our first question is surgery is often considered the first option with a breast cancer diagnosis. Why is that?
That's because the only way, or let's say the best way to eradicate a breast cancer that's localized to the breast is by removing it surgically.
Okay, and there are different surgical options for breast cancer, and what are those?
Yes, so we can remove the tumor and leave the remaining portion of the breast if indeed the tumor is small enough so that after removal, cosmetically, it's acceptable to the woman. If the tumor is too large or spread in a variety of areas of the breast, whereby cosmetically or medically it's not safe, we will remove the whole breast.
Just terminology definition. You hear about mastectomy and radical mastectomy. What is the difference?
Radical mastectomy is of historical interest. It's rarely, if ever, performed any longer. Radical mastectomy removed the muscle under the breast, called the pectoralis major muscle.
Mm-hmm.
It was thought a long time ago that that removal increased survival rates, decreased the chance of the tumor coming back. We now know that that really doesn't matter unless the tumor invades the muscle. And in that case, we will remove a tiny portion of the muscle where the tumor is going in. But rarely do we remove the entire muscle. I would say in a 20-year career, I've done a radical mastectomy once.
Very well, that's interesting. What are the advantages when it comes to breast cancer surgery? What are the advantages to having a breast cancer specializing surgeon do the surgery as opposed to a general surgeon?
An oncologic surgeon who focuses on breast cancer works in a multidisciplinary manner. She or he knows not only the surgical options, but also the other options, when surgery should be done, and the timing of surgery in relation to other treatments. Now, the other treatments, we won't necessarily go into them in great detail right now, unless you want to, but they include radiation, especially if a woman saves the breast after removing the mass. They may include systemic treatments. And a general surgeon may not know the sequence of timing as well as an oncologic surgeon who focuses on breast cancer.
Okay. And this may have answered the next question, but we'll amplify on it. What factors influence a woman's decision regarding her options for breast cancer surgery?
Well, it's individualized. Every woman's different. It's determined by her anxiety regarding the tumor coming back, and that's influenced by her upbringing, by her family, by her friends, and by herself. For some women, they would rather keep the breast. Others, they're more concerned about the tumor coming back and don't want to be concerned about it.
Do surgery, and you mentioned radiation, do surgery and radiation automatically go hand in hand with respect to treating breast cancer?
If the breast is left after removing the mass, it is recommended that radiation occur to that breast. Because if you do not, the chance for the tumor coming back is fourfold higher than if you do treat the breast with radiation.
This is a growing trend, just people that I've talked to, things you hear. A growing number of women, when they have a diagnosis of cancer in one breast, are opting to have both breasts removed. What's driving the trend, and is this a good idea?
Well, a number of things are driving the trend. The first thing that's driving the trend are breast MRIs or other imaging modalities to look for cancer. The more sensitive a technology is to find cancer, the more sensitive it is to find other things that are not cancer. And so a radiologist doing a reading will say, well, there's something there in that other breast. We don't know if it's cancer or not. We can watch it or we can biopsy it. And if the woman's already having surgery on, let's say, the right breast while she's asleep, more frequently, because there's something they see in the other breast, the woman might say, well, you know, I'm concerned about that. I don't want the anxiety or the concern. long term, why don't you just take the other one off at the same time?
Related question. Women who have a strong family history but no symptom, no diagnosis, prophylactically, preventively removing breasts. Discuss that a little bit.
Not all family histories are created equal.
Mm-hmm.
So there are defined genetic mutations that are drivers, primary drivers of breast cancer, most specifically being the BRCA, breast cancer, BRCA genes 1 and 2. And women who carry that gene have about the numbers are vary depending upon what study you report, but at least a 50% up to a 90% lifetime risk of developing breast cancer. For those women, many will opt for removing their breasts because they at least have a flip the coin risk of getting breast cancer.
Mm-hmm.
Now, there are other populations of women who have a higher than normal risk, but far less than 50% over their lifetime. They still may opt for bilateral mastectomy, but are less likely because their risk is lower.
Okay, very well. With respect to surgery, is it better to wait until after breast cancer surgery to deal with the subject of reconstruction?
Well, there are benefits to what we call immediate reconstruction, which is while you're asleep and the breast is removed to have it reconstructed, versus to wait to a later time. The benefit of having immediate reconstruction is you don't have a second operation, you don't have a second anesthetic. It's all done at once. Of course, it takes a longer time to do it all at once as opposed to 2 separate sittings. So again, the advantage to immediate reconstruction primarily is you save an anesthetic and just get it over with, so to speak. The downside is sometimes there's further treatment after surgery.
Mm-hmm.
And if, for example, you require radiation, that could damage or if not destroy the reconstruction.
On the subject of reconstruction, does breast reconstruction in any way affect the chances of detecting future cancers?
In the past, yes. It depends on what kind of reconstruction. Currently, not so much. I'll clarify that. Reconstruction can consist of muscle, with or without fat from the woman, and or an implant. Now, reconstruction, if the breast is removed, doesn't matter because the breast is removed.
Mm-hmm.
So the only time a reconstruction will inhibit breast cancer diagnosis is if there's breast tissue left behind.
Okay.
No breast tissue, doesn't matter. If there's breast tissue left behind and there's a reconstruction, which occurs occasionally, in the old days, a silicone implant could decrease the chance of detecting a tumor in the remaining breast tissue. Silicone is uncommonly used now. It's most commonly saline, and the saline does not significantly impair mammographic detection of breast cancer.
So this would also apply to breast augmentation, same
idea.
calculus. Okay,
Absolutely.
very well. Is there anything a woman can do to reduce the likelihood of a breast cancer diagnosis, to getting breast cancer?
Yes. So first of all, I'm going to say what you can't do, and you can't change your mother and father. So if you're at higher risk based upon a genetic inheritance from mom or dad or both, that's a given. It's important information in terms of your risk based upon genetics. But what you can do is change environmental exposures.
Mm-hmm.
The most obvious one is weight, what your weight is. Obesity significantly increases a woman's risk of postmenopausal breast cancer. So the thinner you are, the lower your risk, especially if you gain a lot of weight during the postmenopausal period after your period stop. That significantly increases your risk. Secondly, hormone replacement therapy. The longer a woman takes hormone replacement therapy, the higher their risk. So decreasing the period of time you're on, especially combination hormone replacement therapy with estrogen and progesterone, should be at the lowest dose for the shortest period of time as possible. And we're doing a lot of studies currently to determine if other interventions will prevent breast cancer. There are 2 FDA-approved medications to prevent breast cancer in high-risk women. There are no approved medications for normal-risk women, but those 2 medications have side effects that most women don't want to tolerate. We're looking at nutritional interventions that are funded by federal agencies, nutritional interventions, I'll repeat, that have essentially no side effects that we are hopeful in the future will be able to help prevent breast cancer.
Related, you may have covered this. What about lifestyle choices to reduce the likelihood?
Cigarette smoking, it looks like it increases breast cancer risk.
Okay.
Alcohol may potentiate that. The data on that is not as clear. Again, eating too much definitely influences risk.
Very well. Doctors, very interesting. Thank you very much for your time.
Thank you.